Joining us now is someone who is in favor of Medicare reform and has been for a long time, North Carolina Congressman and Dr. Greg Murphy. Great to see you, Congressman. I know that Republicans are in the process of trying to figure out where cuts can happen. And we're hearing reports that 20 million people could be impacted. Do people watching right now need to be concerned?
You know, Rob, if we don't do something, that's the real question. If we don't do something, this nation's finances spiral out of control. And what's taken literally the healthcare situation of the country by storm and what's thrown it into such disarray is the middleman. This is what's gotten between doctors and patients, hospitals and physicians. It's ridiculous to how these plans are become the middleman and basically taking money off the top and not delivering services. So the real question is, what if we don't do anything? If we don't do anything, it's an absolute demise of the American healthcare system.
The Congressional Budget Office estimates the work requirement would save around $140 billion over the next 10 years. It's a lot of money. That's a good place to start. What does that mean?
You know, Rob, I still see patients, so this is very real to me. And I see a majority, I mean, not a majority, but I see a fair number of individuals who are on Medicaid. And I can give you two instances, happened on the same day about 6 weeks ago in the office. One was a 35-year-old on Medicaid, and he was on disability, and he was no more disabled than you or I. And another one was a 48-year-old woman that was disabled because she couldn't hear, but she could hear me ask the questions, and she had hearing aids in. You know, these are difficult challenges to overcome, but there are no reason somebody should be on Medicaid disabled and not working. So, is it as high the number as they state? I don't know, but it is sure something that the American public doesn't deserve and needs to be reformed.
So that's interesting. Are you saying that they should both not be on Medicare?
Well, Medicaid is the one that does disabilities. No, I don't personally think they're disabled. And I've seen this time after time again, working the system. And sometimes physicians are guilty of putting people on disability who shouldn't be. And I've seen also patients who should be who are not. So the system really is broken. And thank God we have a president with an attitude towards fixing this.
Well, he's the first president to have the temerity to want to address this. It really has been the third rail for decades now. Ronald Reagan tried to do it, but again, you can only serve 2 terms, and he ran out of time. And then George H.W. Bush tried to reform this process. At the State of the Union address, you know, the joint address to Congress a couple weeks ago, several Democrats were holding up those little placards that said, "Save Medicaid" or "Save Medicare." Are they doing that just to scare people?
Yes, absolutely. And, you know, this is a system, and thank God we have reform in mind, and accountability really is the word of the day. They really don't have any idea what they're talking about. It's rooting out fraud. It's rooting out people who are defrauding the Medicare system, be they providers or be they patients, and getting things back to the states. You know, look, the benefits are not going to be distorted for patients. People are still going to take care of Medicaid patients, but it's a system, just like a lot of government systems, that has grown way out of control and needs reform. Yeah, they're trying to scare people, which is what, sadly enough, I think my Democratic colleagues sometimes try to do, play upon emotions rather than rational thought. But the system and so many of the systems of government drastically need reform.
Congressman, is this part of Mike Johnson and Donald Trump's one big, beautiful bill?
Well, we hope so. You know, there's a lot that goes into that bill. It is going to be a huge Herculean effort, really, by the House and the Senate to get this all done in one bill. But the time is now. It has to be done now. Otherwise, we go into a financial collapse where the nation's really finances and economy is in peril, really in the not too distant future. So now is the time to make really, really hard decisions for the sake of the country.
All right, Congressman, we appreciate you being with us tonight. Thank you for the update. Great to see you as always. Greg Murphy, North Carolina. Thank you.
Thank you.